psychotherapy, any time being spent with the patient. So, but when we talk to these our own colleagues who are in practice now after so many years, we find our practice is different, and we are doing a different type of psychiatry practice. And Dr. Satyanand teaching, and Dr. Dubey's, Dr. Mohan, all these psychiatrists were practicing psychiatry with some psychotherapeutic bent of mind. So this is what I found different, and of course, I'm reminded of so many days which I spent here, about 10 years almost, 5 years in MBBS, and then followed up with this. So I have utilized this knowledge in my practice of psychiatry, and I have tried to build up departments similar to what I learned here. And I find that somehow I feel that those teachers that we had, if they apply same type of, interaction with the students, the quality of students will improve, will be different. Because now you are getting much better quality of students. We were not, I don't think we were as good. No, I'm telling you very frankly, we were not as good. We were ordinary students, I thought. And I found that we became better because of the faculty. Now you have such good faculty, and the quality of students is much better. So the output should be much better, I think. So with these words, I think I'll.
Thank you, sir. I now request Professor Sharan to kindly deliver the vote of thanks.
Professor Malik, I would like to thank you for your very interesting and insightful address, and the kind of honesty that you bring to everything that you do. I would like to thank Dr. S.C. Malik for being a living embodiment of the path traversed by our department, and for being ever available to us for guidance. I'm indebted to Dr. Chadha, our HOD, for envisioning this program and the enthusiasm with which he has led it. We are beholden to Dr. Colonel D.S. Goel, Dr. Premlata Chawla, Dr. S.K. Khandelwal, Dr. Shakuntala Dubey, Dr. Surya Gupta, Dr. Manju Mehta, and Dr. Rakha Jain for being with us while we celebrate their association with the department. To Dr. Rajat Ray, Dr. Shekhar Saxena, and Dr. Parminder Sachdev, we are grateful for their thoughtful journeys and comments that will come following this session. We look forward to the snippets and anecdotes that Dr. Alok Sarin, Dr. Nand Kumar, and Dr. Sanjay Patnaik will share with us, and to Dr. Rajesh Sagar for his evocative inquiries into lives lived well. We are excited to become co-travelers on the varied paths taken by Dr. Anandi Lal, Dr. E. Mohandas, Dr. Rakesh Lal, and Dr. Amya Banerjee, and to Dr. Anju Dhawan for being the Sutradhar to their stories. I would like to thank all the alumni who have joined us, all those who have sent heartfelt messages, and those who are so keen to join but couldn't due to the short notice. We'll have longer notices from next time. We are blessed to have this congenial bunch as our alumni. This celebration is about you. I would like to thank Dr. Gurpreet Gulati and Dr. P. Kumar and residents and faculty for their volunteering to put together a cultural extravaganza for us in the evening, and Dr. Rishi Gupta and Dr. Tomunud Modak for the artistic compilation and creation of more sepia-colored memories as we go on. We cannot thank enough Dr. Atul Ambekar, Dr. Ramandeep, Dr. Siddharth Sarkar, Dr. Shalini Achra, Dr. Preeti K, and Dr. Swati Kedia for the thoughtful care with which they have put this program together. They have worked really, really hard at it. It's absolutely great to have a sunny set of faculty, staff, and scholars in the department and share the bonhomie as we work together. So thank you, everyone.
And thank you to you too, sir. And now, since we have gathered enough momentum, I would like to request our much awaited and real master of ceremony for this Diamond Jubilee event, Professor Atul Ambega, to please come to the podium and then guide us through this trip down the memory lane.
Namaskar and good afternoon, ladies and gentlemen. So as evident from this inaugural ceremony itself, this is really a momentous occasion for the department, for the institute. All of us present here are bound by this thread of being a part of this department in some capacity or the other, at some point in time or the other. Now, here's the interesting thing. Many of us do get an opportunity to interact and meet in some other kind of professional or academic occasions, conferences or CMEs, etc. We exchange some notes, we ask for each other's halchal and so on. Sometimes we also meet on some of the personal or social family type of occasions. But it's very rare to meet for the sake of meeting, to find an occasion where we meet just to discuss and sort of exchange notes on what has been happening, how things are, and how things are moving forward. So this is the explicit purpose with which all of us are meeting today, and I am really looking forward to the proceedings of this day. So this is what we will do today. The program shall be conducted with due grace, with due regard to the proprieties, but I would also wish that all of us relax a bit. So in other words, as per you know, what is the program structure as well. Like the usual academic programs, we do not really have a chairperson here in any of the session. So there are enough senior people around us to moderate us, to guide us, and to keep in general things in order. So that's how we will do. We wish that we will have an atmosphere where the exchange of ideas, thoughts, feelings is sort of facilitated. आगे बढ़ते हैं, we really wish that everyone, all the alumni who are there throughout the world, we wish that they could be here with us in person today. That's not, of course, always feasible. We understand this, and but really all of us present here, those who are young at heart, those who are young at mind, or those who claim to be young at all body parts, are really blessed to have a very seniors among us, a galaxy of stalwarts who have actually seen the discipline of psychiatry grow in India, and not just seen, they have also contributed to the growth and development of this discipline in India. So for the very first session, which is essentially a reflection on the growth of psychiatry in India, I would request Professor Rakesh Chadda, sir, our current head of the department, to please moderate this session. Sir, please take your seat on the dais, sir. The panel is comprised of, so this panel is comprised of Dr. Colonel D.S. Goyal, sir, currently in New Zealand, and whose pearls of wisdom we keep getting on AIIMS forums very often. Also on this panel would be Dr. Premlata Chawla ma'am, again, ex-faculty of the department, and of course, our own Professor S.K. Khandeliwal, sir, the immediate past head of the department. I would request all of you to please take your podium. I will request Professor Chadda actually to do the honor of introducing the panel and take the session forward. Thank you very much, sir. Please.
Thank you, Atul, and warm good afternoon again. As Dr. Atul introduced, we have three of our senior most alumni who represent some differences in the period of their training. Colonel Goyal comes from late 50s and 60s, Dr. Premlata Chawla comes from 60s and early 70s. And Dr. Khandelwal is from 70s. And Colonel Goyal graduated from King George Medical College, Lucknow, and after that he came to Delhi. Today morning we were discussing. He also spent a short time at Safdarjung Hospital doing house job in psychiatry. He also went to Chandigarh. He was also selected for PGI Chandigarh, which was definitely a secret, but he preferred to join at AIIMS for MD Psychiatry. After doing post-graduation, he was in armed forces. Then he was consultant in psychiatry at the Ministry of Health for some time, and then he migrated to New Zealand post-retirement. That's again an unusual thing. People don't go to migrate to foreign countries after retirement from services in India, and especially from the armed forces. Sir has been very active, as Dr. Atul said, and I had honor of having presenting symposia in national, international forums. And this time also he has just come back from, returned from WPA meeting at Vienna. Then we have Dr. Premlata Chawla, who did MD, senior residency, then she was also faculty. I remember Madam was continuing was running the child psychiatry clinic for a number of years at AIIMS. And later she joined at AIIMS, and she's still working there as consultant psychiatrist. And then we have Dr. S.K. Khandelwal, who has been in the department since 1984. He retired in December 2016 as a professor and head the Department of Psychiatry and Chief National Drug Dependence Treatment Center. So I'll open the mic to our panelists. First, I'll request Colonel Goyal to share his thoughts. Sir.
Thank you, Professor Chadda. And it's a great pleasure meeting all of you, including my old friend, Dr. Malik, Dr. Chawla, and so many others. Now, just taking on from what Dr. Malik had said, I think one of the things which was unique to this department when I joined it in January 1966, that Professor Satyanand offered us what I like to call a cafeteria approach. We were exposed to everything, including psychodrama and so on and so forth. And he let us make an informed choice. He educated us to make the right choice, and all of us choose whatever we wanted to do. Dr. Hawk came as an existentialist who had herself trained under Medard Boss, and she inspired me to take up existentialism, which I have continued in one form or another. And subsequently, I had the honor to co-author a paper, Psychiatry as Aid in Administration. Unfortunately, that is no longer available, and that journal has not been digitalized. And I continued my association with her when she moved to Srinagar. But I would just like to broaden this. You see, when we started psychiatry, and I think Dr. Malik would validate me, we had just two antipsychotics, trifluperazine and chlorpromazine, of course, which was the old favorite. And we had two antidepressants, imipramine and amitriptyline, and a third one, which was very weak, niamid, which was an MAO inhibitor of sorts. And we felt at the top of the world. We never bothered about QTC or serum prolactin or things like that. ECG was never done. We never lost a patient. And we really felt at the top of the world. Today, I cannot even name all the antipsychotics which are in use, leave alone the antidepressants. But I really question whether the outcomes have improved at all. And this is what I would like you to introspect. And if you want, I can make an hour-long presentation providing the evidence that in spite of all that progress which has been made, and I'm just expanding the horizon beyond Indian psychiatry, that the outcomes have not improved. The life expectancy gap between mental health patients and the general population has grown. In Australia, during the 2 decades, 1985 to 2005, it had doubled. The outcomes have not improved. 75% of patients still relapse. Long-acting injections, which we have been advocating, and if you have read the recent paper on the ULAST study, which is a very large study across Europe and centers in Israel also, it has shown that they don't ultimately improve the outcomes. Psychiatric diagnoses are changed PDS. You pick up any case sheet and you will find half a dozen left. If you want, I can show you the papers which have shown how pathetic our record is with regard to the stability of psychiatric diagnosis. So this is, please forgive me for being a spoiled sport, but I think we need to introspect on that before we start looking at and counting our achievements and so on and so forth. But having said that, as far as Indian psychiatry is concerned, I have been away for over 18 years now. Dr. Rajesh Sagar perhaps would be able to say more about it. But I spent 5 years in Nirman Bhavan advising the government, and those were 5 years of failure. And one of the lessons I learned was that first you have to build capacity before we were able to increase the mental health budget in the 10th 5-year plan 7 times, from 27 crore to 190 crore. We could not even spend that 190 crore. We spent 140 crore, and I think we just spent it. I don't know whether anything was achieved. So what I would like to do, and as I said, please forgive me for being a spoiled sport, that I am not painting a very rosy picture, but I think we need to introspect as to whether we need to change our course for the future, because I am now going on to 82. So I am the past of psychiatry. You are the future of psychiatry. And that is where I think we need to introspect. Thank you very much.
Thank you, sir, for your reminiscences and remarkable, in fact, these were the gems of words which you have shared, and how the prognosis of personal mental illness has not improved with so many advances in psychiatry and with so many psychotropics. So sometime back in American Journal of Psychiatry, I think sometime 93 or 94, there was a paper which compared the prognosis of patients with schizophrenia before invent of antipsychotics and after invent of antipsychotics, and they did not find any major difference between the two groups. I'll now request Madam Dr. Premlata Chawla to share her thoughts.
Well, first of all, thank you very much for having me here, because I am more or less a dropout. More or less a dropout from the mainstream, because I went into private practice right in 84. So, but then I have interesting stories to tell, like why I came to psychiatry and what kept me going on in psychiatry. That's more important, because one comes into any field because one is inspired by a teacher or something. Same thing happened with me. It was Dr. Vidyasagar and Amaris sir doing good work with patients. So I said I'll also choose psychiatry. And later when I came to psychiatry when the aura of Dr. Satyanand was still there. That psychodrama, talking to patients, Freudian school of thought. In fact, in my time, we devoted 6 months to a psychoanalytics, Freudian, total to academic session. Like, I'm so well versed in that. But then later I realized for myself, even while studying it, that this has nothing to do with psychiatric vision. Psychiatric diseases are a pathology of the brain. And this gentleman, Freud, tried to describe human development, personality development, which has nothing to do with illnesses. That everyone knows. But then why did I stick to psychiatry? That is more important. Because at that time when I joined, there were no medication. My first introduction to medicines was paraldehyde. Has anyone heard of it? Injection paraldehyde we used to give intramuscular. And I think patients would get well just because of the pain that injection caused. And it's a very thick solution and you have to really push it in. The nurse in our ward was very efficient in giving those paraldehyde injections. So, why I persisted, later on only I thought about it and then I came to this conclusion that not at that time, because when I joined, as somebody you mentioned, Dr. Malik mentioned that you are getting now better students. At that time, maybe I was good in academics, but I was a kid, no worldly knowledge, and I was actually a kid with a bravado, which means I was a fool too, not just a kid. Later I saw realized that I found psychiatry very interesting because it offers what is called a lived human experience to a doctor. Like I am very fond of reading literature. You can say I'm a sucker for stories. And there are patients telling me stories, real life stories. What is more interesting than the fiction? So that is how I continued. Like my threshold for boredom is quite low. I get bored very easily, but there's something which still at 80, I'm not bored, that is listening to a patient's story. Before the illness, after the illness, not just the patient, the caretakers, before and after. Vast human material, so much learning, so much fascinating how people live, manage, that kept me going. And the other thing which kept me going was management of hysterical patients. Like in a government hospital, it's very easy to manage hysteria. Get up, you have no illness. Get up. Patient gets up and you feel so good at the top of the world. So these were the few things which kept me going. Then the department was small, very cohesive, we were very friendly. Here is Dr. Goel. And I was just telling him that I learned more psychiatry in the coffee room of our psychiatry department rather than the academics and all. There were teachers. Dr. Dubey is here. She's the one who introduced us to Pavlov, the learning, and then we read psychology. It's so interesting if you really, it is a very academic, very interesting subject to read, although the direct application to patient isn't it. So those were the departments, and then the Dr. Satyanand's aura of listening to the patient. That is how we listen to the patients, learn the stories, and that habit has continued. And I would suggest it to all the youngsters. Okay, don't reduce psychiatry to pills. Just listen to them. Part of the problem is sorted out by listening to them. And whatever part the drugs do. Of course, schizophrenia is a very biochemical disease of the brain. My own hypothesis is that it's just like MS, the multiple sclerosis. Only thing is the patch is still not demonstrated. That it comes and goes. There's a damage, there is a residual damage which keeps on adding, and finally there is total damage. Even illnesses like that, we have to take care of the families and take care of the patient. So that is what, and then eventually the drugs came up. So like Serenase was introduced and we felt so good with Serenase, haloperidol, and then lithium came. Then it seems the problems of the world are sorted out. And now, of course, Dr. Goel was little negative. I am little positive about what happened to psychiatry in future. Because I remember having practiced psychiatry as a registrar at an early stages of faculty, that I used to practice with folded hands and with an apology on my lips. ठीक हो जाएगा, कोशिश कर रहे हैं, जरूर ठीक होगा, करते रहिए, बेड नहीं है, बेड खाली नहीं है, इसको एडमिशन तो चाहिए, पर बेड खाली नहीं. This is how I practice. Now I say, 3 हफ्ते में ठीक हो जाएगा, आप persist with it. 1 हफ्ते में आपको difference दिखेगा. Oh, this is what olanzapine does to the patient. Acute illnesses or get well. So even the worst of a psychiatrist is doing very well because acute illnesses get well. Whatever combination you do. It's the later on, then I tell the family, ठीक तो मैं कर दूंगी, ठीक रखना आपका काम. That also I tell with confidence, that we have no medicine which will cure the illness, but it will keep under control. There is definitely mortality rate is high with these things, but then there's a choice between two evils, either the quality of life or the quantity of life. I tell them to the patients later on, देख लेंगे जब होगा, अभी जिंदगी तो जियो like this. So earlier I used to practice with apologetic. Now I practice with confidence. And I would say my confidence probably gets communicated to the patient. ठीक हो जाएगा कह रही हूँ ना, ठीक हो जाए 3 हफ्ते में, आप बीच में आने की जरूरत नहीं. You can call me if there is any problem or you have a question. But actually patient, give antidepressant full dose. I give full dose in the beginning. 40 milligram fluoxetine से शुरू करती हूँ मैं, कभी उससे कम से शुरू ही नहीं करती किसी को. And definitely the patient gets well. So these 2 points I wanted to share, that the change of psychiatry and what happened to that various kinds of psychotherapies that I learned from Professor Neki. And that also, I clearly remember a patient, but Dr. Neki believed in that guru-chela relationship, that doctor is in a position and doctor will dictate and the patient has to learn, and patients are ready. His concept was Indian patients are different. They come for advice and they want doctor to advise them and try to fix a routine for their life. So I followed that. And I would tell it to the doctors. Doctors, like the younger students, doctors' words, they're very important. Very important. So they should be careful with their words and they should be sincere with their words. सोच समझ के बहुत advice दीजिए. So that works. Like I remember there was this child was brought with a resistant asthma to steroids and then diagnosed in the AIIMS as hyperventilation and then sent to psychiatry. And then Dr. Neki asked the mother, what's the problem? Child is anxious. That means parents are anxious. And then the whole drama started about marital disharmony. Dr. Neki said, why don't you divorce him? She was stumped. Treatment done. Nothing more needs to be done. Because she has to take a decision. So I followed that school of thought. देखिए ऐसा है, ऐसा कर लेंगे तो ठीक हो जाएगा, आपकी मर्जी है. सफर करना है, सारी जिंदगी सफर करते रहिए, दवाई भी खाते रहिए. No hanky-panky business, details. And then I tell them, you can go for psychotherapy, you can have as many sessions, but if you want to learn, you can learn in one session. So that's the kind of confidence I developed over years when I felt the medicines are effective and the doctor's word is even more effective. So that is the change I discovered. And one more incident, which is very sort of dear to me, I want to tell. When I was scolded right, left, center, everywhere by Professor Neki as a student, because I presented a patient in the ward. I said, it's normal. He said, is the patient normal? I said, normal. What more? He says. I said, normal. And he says, and this patient had come to institute on his own request. He used to write letters to Dr. Keswani that he has solved the problems of hunger of the world because he eats only stones. And they can do experiments, physiological experiments. Dr. Keswani was a physiologist also. And then the problem of the world is sorted out. So he called, he passed the letter on to Dr. Neki and they called him to AIIMS Institute. They admitted him. And patient was assigned to me. और मैं तो उसको बात करी, अच्छा भला लड़का, तो I said normal, खत्म, history done. And Dr. Neki got force treated him by saying no food to be given to him at all. And then we found him eating at a dhaba. So that practical. So I learned to be with that practical. And why was I scolded? And what I learned that day, the importance of the mental state examination. That you have to do some mental state examination to prove that the person is normal or abnormal. Like if you're standing in the court of law, then there's so many points they're going to ask you. That is how. So this is again for the student. The mental state examinations, elicitation of symptoms. Then, and find the difference between normal, okay, is it normal, this not normal, when to call it abnormal, when to not to call it normal. That was the day I learned when I gave him history in one word. And we diagnose that patient as pseudologia fantastica. I think that word is not used anywhere there these days. Pseudologia fantastica means telling lies which are fantastic. So, so this is how life proceeded. Otherwise, we were very happy in the department. The teachers, everybody was very cordial, and we used to have a coffee room. I wonder if you people have a coffee room now, where we used to interact. And then in the coffee room, we used to sit, myself, Dr. Goel, and Dr. Dwani, and Jacob John, and others, and solve the problems of the world. Every problem of the world we could solve sitting over there. Those were fun days. And afterwards also, psychiatry, I think, developed, and the private practice became a little easier for me. I started practicing when there were no phones. And most of our patients would, like most of the drugs which are we prescribed, had produced severe extrapyramidal system side effects. And there was no way the patient could communicate. So, and like that is another advancement. Now their phones said anything happens immediately, there is a phone call managed on the phone. And when I joined private practice, I thought now I'm going to stop, because no one gets well. There are so many side effects. Nobody wants ECT, but then it worked. Another thing I changed in my life, I'm taking too much of time, that is the management of hysteria. Government hospital, this works, not in private practice. No way. So, but I have devised, looking at the patient, I have innovate. You have to convey that this is hysteria, this is not acceptable. So, take as an educated girl getting it. Oh, you're so educated, you're getting hysterical symptoms. Oh, no, it's very distressing. Educated. So this is how you innovate. So learn. Okay. Thank you.
I just wanted to add that myself and Dr. Chawla, we were both part of a team that looked after the, we were asked by the Supreme Court. Of course, the chairperson was Dr. Sridhar Sharma, but we examined each and every patient of Shadra Mental Hospital, each and every patient of Shadra Mental Hospital, and also the jail, inside the jail. And we recalled it. And we even used to tell that this patient, if he is not looked after, he may die. And when we went the next time, that patient was dead also. It was, and we brought it out in a, and whatever the result was, that the Shadra Mental Hospital was changed to the present AIIMS. It was the effort of both of us had also joined in the effort. So we did that was a very solid work that was done at that time. We took very seriously that work. We did very seriously.
Thank you, madam, for your words of wisdom from your long experience at AIIMS and then later in private practice. I think most of us have gained a lot from your experiences of dealing with the patients. Now we have Dr. S.K. Khandelwal. I think most of you know that sir has been at AIIMS for nearly 30 years. He has served AIIMS for 30 years. But Dr. Khandelwal has been, I don't think there would be many such persons who have worked in as psychiatrists in 3 continents. Sir has worked in Ethiopia for 3 years as consultant, for 2 years at Ethiopia, 2 years in Nepal, then 2 years in UK.
4 continents, that makes 4 continents.
नहीं सर,
Asia.
सर नेपाल तो एक ही कॉन्टिनेंट है. नेपाल और इंडिया.
4 countries, 3 continents.
हाँ हाँ, एंटार्क्टिका में बोलने वाला था एक्चुअली ना, पर एंटार्क्टिका ही वाज नॉट ए साइकियाट्रिस्ट एक्चुअली ना. Yeah. So I'll request sir to share his experiences.
चक्कर क्या है राकेश कि मेरे विचार बहुत जम्बल्ड अप हैं इस समय. सॉरी अतुल इफ आई डिसअपॉइंट यू.
क्योंकि इतने ज्यादा है.
एग्जैक्टली मैडम, इसलिए ज्यादा इसलिए है कि पिछले महीने पीजीआई चंडीगढ़, वो भी मेरा एक आल्मा मैटर है, वहां पे हमने डायमंड जुबली सेलिब्रेशन 3-day लॉन्ग प्रोग्राम अटेंड किया. एंड आई वाज क्वाइट इन्वॉल्व्ड इन द academic and other activities of the department there. Too many stories, too many experiences. और अब यहाँ पे भी हम डायमंड जुबली सेलिब्रेट कर रहे हैं. अब समझ में नहीं आ रहा कि कौन से विचार को कहाँ पे लेके आऊं मैं कि कोई कोहेरेंट स्टोरी बने. और जो आफ्टर लिसनिंग टू प्रोफेसर मलिक, डॉक्टर DS गोयल, कर्नल DS गोयल एंड देन मैडम चावला, थोड़ा सा मेरे को नर्वसनेस है कि whether I will be able to do justice to the time I have been allotted to. Like all these great stalwarts, they had their teachers who were their role models. I too had my role models. जैसा आप मैंने बताया कि मैं पीजीआई चंडीगढ़ से मैंने MD साइकियाट्री करी, तो हमारे भी वहाँ रोल मॉडल रहे. प्रोफेसर विग वाज ए रोल मॉडल एंड प्रोफेसर विग रोल मॉडल रहे perhaps to all the psychiatrists in India and maybe abroad also. And then VK Verma, आज और हम साइकोथेरेपी की बात कर रहे हैं, and VK Verma was a fantastic teacher in psychodynamic principles. And then Professor R.S. Murthy, the public health man. So they were our role models. आपने मैडम विद्यासागर जी का नाम लिया, डॉक्टर विद्यासागर, जिनको हम सब लोग बहुत ही हाई एस्टीम में रखते हैं, जिन्होंने वो फैमिली थेरेपी और वार्ड शुरू किया. आप अमृतसर में थी. पीजीआई में उनकी स्टोरीज भी सुनते थे और उनके रेफर या उनके देखे हुए पेशेंट्स भी पीजीआई में कई बार देखने को मिलते थे. मैंने उनको कभी मैं मिला नहीं. मेरे पास एक मैं जब पीजीआई में जूनियर रेजिडेंट था तो एक पेशेंट आया, और जब मैं उसकी हिस्ट्री ले रहा था तो उसने मेरे को बताया कि उसका पहले ट्रीटमेंट अमृतसर में हुआ डॉक्टर विद्यासागर के द्वारा. तो पीजीआई में एक ट्रेडिशन था कि लेटर लिखो, अगर जीपी ने रेफर किया आपको तो जीपी को लेटर लिखो, थैंक यू का लिखो या इन्फॉर्म करो कि आपका पेशेंट हमने देखा है, उसको ये हमने एडवाइस किया है. तो ये थोड़ी बहुत हम भी एम्बाइब कर रहे थे कि कम्युनिकेट करना चाहिए. और मैं जूनियर रेजिडेंट था, मैंने तो प्रोफेसर विक से भी नहीं पूछा, मैंने खुद उनको चिट्ठी लिख दी, हाथ से चिट्ठी लिख दी कि सर आपका देखा हुआ पेशेंट आया है हमारे पास और उसको इस समय ये प्रॉब्लम है, और अगर आप इसके बारे में कुछ बता सकें तो बता दीजिए. हालांकि ऐसा कुछ था नहीं कि उनसे कुछ, क्योंकि वो डायग्नोसिस शायद बहुत ही क्लियर थी. But lo and behold, Professor Vidyasagar responded to my letter. I was just a junior resident, first year junior resident. उनका हाथ का लिखा हुआ लेटर मेरे पास आया कुछ दिनों बाद, which I showed to Professor Wig. अगर वो फाइल ढूंढी जाए तो शायद उस फाइल में अभी भी लगा होगा. और उनको सिर्फ नाम था और कोई आइडेंटिटी नहीं थी, कोई नंबर भी नहीं था मेरे पास. उस पेशेंट ने भी कोई नंबर नहीं दिया था, जो एक साइकियाट्री का नंबर, लेकिन उनको नाम से याद आ गया और उन्होंने लिख दिया उसके बारे में वही सब जो मैंने अपनी हिस्ट्री में देखा था. ये वाली बात है डॉक्टर विद्यासागर की. डॉक्टर नेकी का भी अभी यहाँ पे जिक्र हुआ मैडम. डॉक्टर नेकी शायद बहुत लोगों को पता है कि नहीं, डॉक्टर नेकी यहाँ पे तो प्रोफेसर रहे, हेड रहे बहुत टाइम, लेकिन वो पीजीआई में डायरेक्टर के रूप में आए. 1978 में
जब इमरजेंसी खत्म हो गई और गवर्नमेंट चेंज हो गई तो डॉक्टर नेकी पीजीआई में डायरेक्टर के रूप में आए। सर वो आए 78 में थे, इमरजेंसी खत्म हो गई थी 77 में।
इमरजेंसी खत्म हो गई 77
लेकिन ही केम इन 78। तो वो वहां पे क्लिनिक भी करते थे और जो हिस्टीरिया का ट्रीटमेंट है वो कहते थे हिस्टीरिया का, अब तो शायद यहाँ अब तो हिस्टीरिया देखने को मिलता ही नहीं है।
नहीं होता है ऐसा, पेशेंट तो आते हैं।
आते हैं, अब पता नहीं, अब तो पता नहीं बहुत ही, हाँ नहीं उस नाम से भी शायद बदल के नहीं आते अब कितने जो यहाँ पे रेजिडेंट्स उन्होंने एफोनिया का या पैराप्लीजिया का नहीं कितने केसेस देखे आप, सिर तो हिला एनीवे। तो वो कहते थे कि हिस्टीरिया का ट्रीटमेंट एक सेशन में हो जाना चाहिए। अगर पेशेंट स्ट्रेचर पे आया है तो उसको उस सेशन के बाद वॉक करके जाना चाहिए। अगर आपने उसका एक सेशन में हिस्टीरिया ठीक नहीं किया तो या तो डायग्नोसिस गलत है या आप अच्छे साइकियाट्रिस्ट नहीं हो। तो ये उनका तरीका था पेशेंट ठीक करने का कि हिस्टीरिया मस्ट बी ब्रोकन इन द फर्स्ट इंस्टेंस इटसेल्फ। ये दो मेरे को जो आप लोगों ने टीचर्स के नाम लिए उनमें से ये मेरे को दो बहुत ही याद है। और बहुत सारी बातें पीजीआई की हैं, वो इस समय यहाँ पे करना ठीक नहीं है, कभी करेंगे। मैं एज ए फैकल्टी आया मैडम, और बहुत जल्दी उसके बाद बहुत जल्दी आप चली गई, बहुत जल्दी। यस। तो यहाँ का पीरियड भी बड़ा एक्साइटिंग सा रहा। कई तरह के लोगों से काम करने का मौका मिला। पीजीआई में और एम्स में काफी डिफरेंस था। वो डिफरेंस अब डिस्कस करने का मौका नहीं है। नहीं करना चाहिए, बड़ा सेक्रोसेंट माहौल है, उसकी गरिमा बनाए रखनी चाहिए। तो लेकिन बहुत डिफरेंस था और सडनली लगा कि जैसे किसी ने मेरे को समुद्र में शिप में से जाते हुए फेंक दिया कि बेटा तैर अब। AIIMS had that kind of atmosphere or whatever it was. और दिल्ली में था बिल्कुल हार्ट ऑफ द कंट्री, और पॉलिटिक्स का बहुत डिस्कशन होता था कॉफी रूम में। पीजीआई के कॉफी रूम में, अब एक दो बातें बता देता हूँ। पीजीआई के कॉफी रूम में बुक्स डिस्कस होती थी, कोई न्यूज आइटम डिस्कस होता था, फिल्म भी डिस्कस हो जाती थी, पॉलिटिक्स नहीं डिस्कस होती थी। यहाँ के कॉफी रूम में पॉलिटिक्स डिस्कस होती थी। पॉलिटिशियन किसका कौन है, किसके किससे ताल्लुकात हैं, वो वाली तरह की बातें। तो ये एक बड़ा वो था। एकेडमिक्स को कैसे, जब तक मैडम मैं आया तब तक एकेडमिक्स का वो वो काफी चेंज हो गया था। तो वो बहुत चेंज था पीजीआई में और यहाँ पर। आई एम नॉट ट्राइंग टू मेक डिफरेंसेस बिटवीन द टू, बट हर एक इंस्टीट्यूशन की अपनी वो होती हैं। लेकिन यहाँ पे भी काम करके बड़ा मजा आया। और यहाँ पे जो मेरे साथी मिले ओवर द इयर्स, डॉक्टर मोहन से भी सीखने को मिला, डॉक्टर रजत रे से भी सीखने को मिला। हालांकि उनकी स्पेशलिटी ड्रग डिपेंडेंस की थी, जो मेरे फेवरेट सब नहीं था टॉपिक, लेकिन उनसे भी कई बातें सीखने को मिली। और फिर डॉक्टर शेखर सक्सेना, और फिर उसके बाद तो फिर प्रताप, राकेश, और फिर अतुल, कौशिक, या और जिनके नाम मैं नहीं ले पा रहा हूँ, राजेश सागर तो जिसे कहते हैं ना कि दैट इज हिज वे ऑफ लाइफ, कलेक्टिंग अवार्ड्स हिज वे ऑफ लाइफ। मतलब किसी और दिन कहूंगा मैं राजेश। लेकिन it feels so proud, you know, that person whom you have worked with, who was your colleague, and he is being recognized all over the world and within India. and keeping the flag high of this Department of Psychiatry at AIIMS. Great, wonderful, Rajesh. Number of things I have learned from my colleagues. और आज मंजू भी है, मैडम दुबे भी है, राका जैन भी है, और इन सब से भी मेरे को काफी कुछ सीखने को मिला और ये बड़ी अच्छी यादें हैं। मैं बहुत बार सोचा है कि मैंने लिखूं, लेकिन पता नहीं क्या लगता है, दिल्ली की जिंदगी ना जैसे भागती चली जा रही है बैठ के लिखने का टाइम नहीं मिलता, लेकिन ये सब बड़ी लिखने की बातें। और मैं आजकल जो मेरा आजकल प्रीऑक्यूपेशन है वो है, मैं एक आपके बात शेयर करना चाहता हूँ जो शायद मैंने कुछ लोगों से करी है, बहुत लोगों से नहीं करी। 2019 में आई वाज डिटेक्टेड टू हैव CA breast. 2019 से। तो वो बड़ा स्ट्रेसफुल पीरियड था कि ये कैंसर से आ गया। मैं तो सब कुछ अच्छा कर रहा था, आई वाज एक्सरसाइजिंग, मैंने किसी का बुरा भी नहीं किया, आई वाज नॉट स्मोकिंग, आई वाज नॉट ड्रिंकिंग टू मच, फिर भी हो गया। अब हो जाती है वही चीजें, क्या करें। तो उस समय आई डिस्कवर्ड द पावर ऑफ जर्नलिंग, लिखना, डायरी लिखना, जिसे पहले सीधी सादी भाषा में डायरी लिखना कहते थे, आजकल वो जर्नलिंग है। मैंने वो पावर ऑफ जर्नलिंग डिस्कवर करी, मेरे को ऑब्वियसली किसी ने सजेस्ट करा था, और अब मैं ये लोगों को काफी एडवाइस करता हूँ, और मैं काफी लोगों के कांटेक्ट में हूँ जिनको कैंसर हुआ मैडम, और या दोस्त कोविड में जो कि दोज हु हैव गॉन थ्रू ग्रीफ। आजकल तो कोविड के बिना कोई डॉक पूरी नहीं होती, तो मैं भी कोविड की बात कर रहा हूँ। वी हैव लॉस्ट लॉट ऑफ आवर कलीग्स, younger people, senior people, and it's a very traumatic experience, and how to console them. And I have always now, it's a bottom line for everything, that start journaling, कि आप अपने एक्सपीरियंस लिखिए। और ये मैं बातें काफी जो यहाँ पे यंगर लोग हैं, कि डिस्कवर द आर्ट ऑफ एक्सप्रेशन ऑफ योर थॉट्स। ये जो जर्नलिंग है ना, आज जो एक सेशन था सुबह, वो ग्रुप एक्सपीरियंस का, क्या नीतीश चलेगा कि है यहाँ पर अभी? नहीं यहाँ नहीं होंगे। नीतीश पेनुली था ना वो, जो जिन्होंने ग्रुप एक्सपीरियंस का आज एक सेशन दिया 2-2.5 घंटे का, और हाउ टू वर्बलाइज योर थॉट्स। तो हाउ टू पुट योर थॉट्स, योर इमोशंस, your fears, your demons into words. That's a very healthy therapeutic experience. All of you should learn and should tell your patients also. I continue to write small my experience with travels, but that is also, but this journaling thing, writing a journal or a diary, and if you read, it's not that something which I have discovered, I was advised, and then I discovered that a lot of articles are available in literature about the power of journaling to overcome any emotional or physical trauma. एक और बात मैं 1 मिनट का और बोलूंगा। मेरा काफी प्रीऑक्यूपेशन रहा है फिजिकल एक्सरसाइज के साथ। मैं ये 2 बातों के लिए कह रहा हूं। एक तो ये कि आप जो भी अपने पेशेंट्स को देखेंगे, और लेट्स होप कि आपके पेशेंट सरवाइव करें और जो नॉर्मल लाइफ एक्सपेक्टेंसी है हमारे देश की, वहां तक पहुंचे। और हम ये भी जानते हैं कि मेंटल इलनेसेस क्रॉनिक इलनेसेस है। तो आज एक अगर बच्चा आपके साथ 20 साल का आता है, यंग एज में बीमारियां शुरू हो जाती है, स्किज़ोफ्रेनिया, बाइपोलर, उसके 50 साल इस बीमारी में बीतने, तो उसको ठीक रखने के लिए आपका भी स्वस्थ रहना जरूरी है। आप उसको स्वस्थ तभी रख पाएंगे when you also have a good healthy life. So kindly look after your health. तो मेरा हर एक को ये एडवाइस है, जो यहाँ पे रेजिडेंट्स हैं या जो भी यंगर लोग हैं, कि दे मस्ट स्पेंड ऑन देयर बॉडी, दे मस्ट इन्वेस्ट एटलीस्ट 1 hour of their 24 hours in looking after their physical health. क्योंकि एज को आप नहीं कंट्रोल कर सकते, जेंडर को आप कंट्रोल नहीं कर सकते, जेनेटिक्स को आप कुछ नहीं बदल नहीं सकते. द ओनली थिंग you can do is to exercise and bring all the changes which are health damaging factors. So look after yourself, and the same advice we must impart to our patients, that if they have to, जो मैडम आपने कहा कि भाई मैंने अपना काम करा है, दवाई करेगी, लेकिन दवाई के साथ साथ एक जो मेरी कांस्टेंट एडवाइस रहती है, और ऐसा नहीं कि अभी कोविड में ये मेरा प्रीऑक्यूपेशन हो गया. मेरे पास होली फैमिली में एक पेशेंट है जिसको मैंने 30 साल पहले यहाँ देखा था, उसमें भी मैंने लिखा हुआ 5 किलोमीटर वॉक. और 15 साल का एक अभी पेशेंट आया पिछले महीने, जिसमें मैंने लिखा है कि डेली योगा एंड डेली वॉक. तो व्हाट आई एम ट्राइंग टू से इज दैट अपना भी हम ख्याल रखें, बड़ा जरूरी है. पेशेंट का तो ख्याल आप रखते ही हो, अपना भी ख्याल रखें. और एक ये फिजिकल हेल्थ का, फिजिकल एक्सरसाइजेस का, और मैंने ये अभी रिव्यू किया क्योंकि चंडीगढ़ में मेरी टॉक यही थी कि हाउ it has a benefit in everything, in preventing mental illnesses, in promoting mental health, and as a therapeutic modality for all these major disorders, whether it's schizophrenia, bipolar, opiate dependence, or after effects of COVID, everywhere. In fact, when I was reviewing on the PubMed about physical exercising and mental health, 2020 में there were only 2 articles, Rakesh, only 2 articles on the effect of physical exercise on mental health. 21 में they mushroomed to more than 1600 within a year, when the health administrators and the health providers, they realized that people have become totally physically inactive, you know, and suddenly 1600 articles appeared in 1 year about the role of physical exercises on mental health. So that is my last message for this afternoon. Thank you very much.
Thank you, sir. We are coming to the end of this session. In fact, if I speak of my 40 years of psychiatry, first 20 years, there was not any discussion on mental health. All the discussion was on treating mental illness. The 21st century, there has been a lot of discussion on health, well-being, lifestyle modification. Lifestyle modification used to be talked about for cardiac illnesses, not for mental illnesses. And for most common mental disorders, they can be prevented with lifestyle modification, following a healthy lifestyle. And another important thing, last few years, all of us have often heard one or other young person losing life because of some cardiac problem, because of some other issues. So in that background, taking care of your physical health becomes very important, and also advising your patients to take care of their physical health. I'm thankful to Dr. Colonel Goyal, Dr. Mrs. Chawla, Dr. Khandelwal, and all of you for making this program, this session very successful. Over to Dr. Atul.
Thank you, sir. Thank you very much for this panel discussion, sir, ma'am. I'm sure all of you have enjoyed this panel discussion, how enriching, how wide in scope this entire session was for all of us. Please join me in giving once again a big hand to all three senior panelists for sharing their experiences, their wisdom, and I'm sure all of us have taken back a lot to learn in professional as well as personal terms. As Dr. Khandelwal was also telling us, and often repeated cliche, the life is what happens when you are busy making other plans. तो time निकलता जाता है. किसी ने शायर ने कहा भी है, जी लो हर लम्हा बीत जाने से पहले, जो लौट कर आती हैं वो यादें होती हैं, वक्त नहीं. So time तो बस गुजरता जाता है. But then there is something which can capture a frame of time for us, right? वक्त को पकड़ के रखने का, कैद करने का एक तरीका होता है, इसको हम कहते हैं फोटोग्राफ. So ओवर द अभी तो फोटोग्राफ बहुत आसान हो गई, हम सबके पास एक कैमरा जेब में होता है. बट उस जमाने से, उस दौर से, जब कैमरा या फोटो बहुत रेयर चीज होती थी, उस टाइम के कुछ रेयर कलेक्शन ऑफ फोटोग्राफ्स हैं हमारे पास. एक डिजिटल पिटारा हमने बनाया है हमारे दोस्त ऋषि ने. सो मैं रिक्वेस्ट करूंगा ऋषि से, ऋषि प्लीज वॉक अस थ्रू दैट मेमोरी लेन यूजिंग दैट कलेक्शन ऑफ फोटोग्राफ्स. थैंक यू वेरी मच ऋषि.
Good afternoon, everyone. I'm Rishi Gupta. I had the fortune of joining the department in 2014 as a junior resident and continued till 2020. Completed my senior residency here. While this is getting set up, let's have the all right. Thank you, sir. So I'll just give a couple of words on my sort of brief experience in compiling this. So yes, ma'am. Right, ma'am. Okay. So I would, before we begin, we reached out to people to share photographs. Ramandeep ma'am, Preeti, Tamanod, Dr. Shashi Bhushan sent us a nice folder of photographs, and I personally had a lot of fun going through these, sifting through these, not recognizing a lot of people, but then ma'am helped me out. And at the sound of making people paranoid, most of you might not know me, but I feel I really know this entire room very, very well now. And through this very small, slightly cheeky presentation, we will begin with a few very old, precious gems, a couple of which Dr. Malik, Professor Malik showed us, similar to those, and then go on to a few memories. Everybody in person may not have been caught, but I wish I tried to catch every era in terms of every, at least set of 2 or 3 years, where my target was that, or our target was that everybody should at least see a couple of photos where they recognize कि हाँ ये इस फोटो को मैं पहचानता हूँ या इस फोटो को मैं पहचानती हूँ. And after this, I would like to invite people to, any photo which they recognize, to please just come forward and say a couple of words about that particular photograph, that particular moment, or the number of or those particular people who were involved in that photograph. With that, I would request Dr. Kaushik to please. Ma'am to hai sir. So the thing is that we have these photographs separately as well, and we shall come back to them after the presentation to, The selected old pics ones. So I would now like to invite anyone and everyone to please just have a look at the photograph and come forward with, whatever experiences you might have with the photograph or with the people in the photograph. And maybe introduce us to a few people whom only you would know and not others. So I think I can, yes, ma'am.
Actually, this photograph is Dr. And then Dr. Mohan, Dr. Rajat Ray, myself.
Yes, ma'am.
And then Dr. I think
Okay, ma'am. Nanny was there.
And this was also PA like Ganga.
I think this was the photograph with the administrative staff.
Yeah.
There.
This is my wedding 78.
Oh, wow.
Dr. K.R. Rock and Dr. P.M. Downey.
Right, sir. Thank you, sir.
This is also the same pair, Dr. Goda and Dr. Bhugyana.
All right, sir.
Professor Nikki and
With Mrs. Nikki.
this is 91, my
Right, sir.
son's birthday. And Dr. Ray, Dr. Vinay Kapoor.
Vinay Kapoor.
Right, sir.
Dr. Vinay Kapoor.
Dr. Vinay Kapoor is there.
Dr.
Is-
Doctor, yeah, Gigi Prabhu is there. He is my contemporary.
Right, ma'am.
He is there in this. Dr. Reddy is also first batch Kenya. Dr. Malik Reddy from Hyderabad. And this lady was Mrs. Gupta, social worker.
Social law. Yes.
That day the department also, some of the nurses are missing. They were very much part of it.
Thank you. Yes, ma'am. Yes, ma'am.
He used to take us to on field with the craft and all.
Okay.
You must know all the resources available.
Right. Right, ma'am. Right.
This was the first meeting of the conference for the forensic toxicologists held at our department in 1991. So our department, our center, trained those staff who came from different labs,
Yes.
some related to criminology and forensic departments of other states.
Right.
So this was the first training program held at our department. So Dr. Mohan, Dr. Ray, myself, and Dr. Dubey, Meera Vaswani, and all the other
Yes.
participants were there.
Right. Thank you, ma'am. We have just one, I think this is from 1971. If we, if any, I can recognize ma'am.
And also the department.
Next to Advani.
Okay, idhar ma'am, It's second, middle row, na? All right. Very nice, ma'am. Very nice.
Dr. Sagar has just reminded me I had some hair at that time. That was rather rude of you.
Very nice. So. Okay. So these were the old ones, and then I saw a few people recognizing a couple of other photographs from the recent ones. So would anybody like to say
We
anything?
have sent some photos which are
Ha, ma'am.
of Dr.
How do we?
Vig, Dr. Vig also department. Because Dr. Vig was also, and then Vig was part of the Department of Psychiatry.
Right. Ma'am.
And
He was head at one time.
head of the department.
Right.
Before.
Then I think he went to PJ and Dr. Neki came here.
No,
No.
he came from PJ.
Acha, okay, the other way.
And Dr. Vig from Lucknow Medical College, he was in medicine. Much later.
Much later, right. Thank you, ma'am. Anybody else would like to share anything about any of the other
Ji
photographs?
Prabhu was very part of our department when Dr. Satyanand
Right,
started. Dr. Malik, remember? G. Prabhu. And when I came back from America, G. Prabhu went to, in absentia was become, and he went to NIMS Bangalore.
Later, he
And
went in
trained
80.
many of the clinical psychologists.
Right.
And in Ranchi, Dr. Satyanand brought him from Ranchi. This is very important link.
Which one? This ma'am ka jo hai? No, so this is, and this is one where in the AIIMS meeting. Because ma'am, that was one photograph in which we did not recognize two people, the one standing to the extreme right. Aapko to of course we did,
Later on, we can.
right?
I think let's end with the poetry. Tasveer teri dil mera behla na sakegi. This room reminds us lot of memory, and these tasveer, these photos, mera dil nahi behla sakegi.
Kya baat hai. Thank you so much, ma'am. Thank you.
या हिंदी में शुद्ध हिंदी में समय की शिला पर मधुर चित्र कितने किसी ने बनाए और किसी ने मिटाए.
Thank you, ma'am. Yeah. So I would now, right. Okay, so we also have a few video clips from video messages from our alumni who were not able to attend.
Yeah,
And
you'd
so I
like
would
to-
request Dr. Kaushik to please play those clips one by one. Some people have sent these messages in the form of text. We have some video messages and we have a couple of audio messages from Dr. Mahendra Nepal.
My name is Jacob Lim, and I was MD Psychiatry student in AIIMS in New Delhi from 1977 to 1979.
क्या नाम है?
I was there
हमारे टाइम था
lovely period.
बात
and
पता नहीं
professionally he was head.
79
There was Dr. T. Mohan, Dr. Chawla,
79 तक थे चेकअप जब
Dr. Rajat and Boda as SRs. We residents and faculty had a very good time. So I enjoyed myself. Cherish the time that we spent. After passing out, I came back. I came to CMC Velo and joined the faculty, and I was there all my life until I retired in 2010. So now I'm retired and enjoying a life of leisure and mostly carpentry, which was my hobby. So that's what I'm up to. And I wanted to really join in for the celebrations, but I had to miss it for various reasons. I wish you all the best and enjoy yourselves. Thank you.
इनका नाम बोलिए, हमें नहीं याद आ रहा है.
Ma'am, this is Dr. Jacob John.
Oh,
John was here and
Right.
he was a demonstrator around here. Then he came here. Then after that, he went back.
you alone.
After his retirement, he went to Brunei.
Hello everyone, I am Paul Sarma. I completed my MBA from the department in 2020. I'm currently working as an assistant professor in Alumni of Sciences department. Apologies for not being there in person. It has been an honor to be the part of the department. And most of the time I secretly wish people ask me where I completed my residency from. And there is no other way when a patient from Nepal after visiting India comes to me and say they have read my professors and other alumni in the different hospitals. And most of the time I hear that all of them say that Hamara Pawan hai na, Nepal mein hai ki baat. So it has been a wonderful journey of 3 years there, which I will cherish forever. Thank you my professors, my mentors, and my dear friends. Definitely will meet again in other events.
Hello everyone, my name is Shravan Jain. I am MD Psychiatry from AIIMS Delhi of the past 2018. Currently, I'm working for the NHS in the UK. I feel very privileged to be able to record this video message for the Diamond Jubilee celebration of AIIMS Psychiatry Department. I want to congratulate the department on the same. First of all, before I came to this event, I had experimented with a couple of different branches before finally picking and sticking with psychiatry. And I feel like that was one of the best decisions of my life. Our department is very nurturing and caring, and all the people are very approachable. And I feel that it provides a great atmosphere for learning and for growth. So for that, I would really like to thank all my seniors and my colleagues, my mentors and my friends for providing me such an environment for my personal and professional growth. I also want to give a message to the newly joined trainees who come to our department. That is about the scope of learning which is in this department. I feel like when I compare the academics and the clinical practice that is being practiced in AIIMS, I feel like it is at par with the world standards. Having said that, I also note that there are certain practices and certain things that we learn, which are they are even beyond the level set by the world standards. I would say that it's really great to see our department achieving great heights, and I would want to congratulate you all who put in so much effort to achieve that level of excellence. So thank you again for making me a part of this great day. And I hope that the Diamond Jubilee celebrations go great. I am feeling really nostalgic and I wish that I was part of it. But thank you so much for this opportunity to provide a message. Thank you.
Hello everyone, I'm Peter. Enjoyed the Peter at night. I'm a higher training in the UK. I was a junior resident in the Department of Psychiatry from 2013 to 2016. Though I had left the department in 2016, it's safe to say that AIIMS has been a part of me and will always be a part of me. The attributes, the ethos, the skills which I've picked up from respective teachers, as well as colleagues, senior residents, junior residents, they've all been a part of me. And wherever I ended the department, was shaping me into what I am today. And when I think about memories of AIIMS, apart from the excellent clinical learning we have in addition to that,
the academic regulations were increased. I can still remember the critical advisory sessions or feedback that was given by faculty in the seminar room. And then next day after the academic presentation, and it used to have such a great time. And I would definitely say that those were one of the golden days of my life, and I hope you still doing that. And I want to meet some great friends for life in AIIMS. So I'm very thankful for whatever AIIMS has given to me. And yeah, so I feel sad that I'm missing a part of the celebration, and hope you're all having a good time. And I look forward to catch up with the department in the near future. And please feel free to contact me if anyone of you is in London. Thank you so much.
Thank you.
I was saying teacher is giving it to one yard.
We have one audio message from Dr. Mahendra Nepal.
Sorry, once more, Dr. Mahendra Nepal. Year of end of my MBA was December 1985. Currently, I'm working as senior consultant psychiatrist in a private hospital in Sydney. The name of the hospital is around here in Jakarta. And in my health, with the local just in Sydney for patients all over Australia, working from home. And earlier I was tasked with University Teaching Hospital and Institute of Medicine in Kathmandu from 1986 to 2006. I was out there in AIIMS. My sympathy to Professor Brandon Reed and Professor D. Mohan and Professor Shakuntala Vives, stalwarts in their field. AIIMS was and still is the leading department in psychiatry in India as well as in the world. The training day was super. I'm immensely indebted to the clinical trainings I received there. And it's so valuable. I'm using that so much in my practice in Sydney at the moment here. And many of my colleagues at that time, they have become leaders in the field in India, in South Asia, as well as all over the world. And it was so fortunate to be part of such a team. I'll say that thank you so much for giving me this opportunity to speak something about my experience here. Thank you.
Thank you, sir. I would now like to invite Dr. Preeti to please read out a few text messages which we have received.
Thank you, sir. So there have been 4 text messages. First from Dr. Gulbi Advani, sir. So sir had messaged, being a simple resident whose life was a settled between the hostel room and the department,
apartment to department, advisor to advisor. There is not much to reminiscence. The department was on the second floor of the OPD block above the skin department. It consisted of 6 to 7 rooms and about 6 cabins for the residents. The wards were in the building meant for nurses' hostel, as the main building to lodge the wards was under construction. The staff consisted of 1 professor, 1 associate professor, Dr. A.S. Mahal, 1 assistant professor, Dr. J.S. Teja, 1 registrar, Dr. A.K. Agrawal, 2 clinical psychologists, Dr. G.G. Prabhu and Dr. Sakuntala Dubey, and 1 psychiatric social worker, Mrs. K. Gupta. Each year, 3 candidates were registered for MD. The ECT room was on the ground floor of the OPD block. Unmodified ECT used to be administered in the afternoon. Those 3 years, with 3 different heads of the departments, life was nothing short of being on the roller coaster. However, there were many unforgettable memories, like the casual and informal tete-a-tete in the coffee room, occasional dinner by the staff, Dr. J.S. Teja, Dr. G.G. Prabhu, some Saturday evenings with Dr. D. Mohan, visiting clinical psychologists, visiting CP with Dr. D.S. Rastogi for movies, and for ice cream with Dr. D.S. Goyal sir at Wenger's, playing cards with Dr. Sachin Wala, late night harangues by Dr. B.R. Agnihotri, and rare visit to the girls' hostel for birthday party. Above all, the best memories are of my hostel room on the first floor, bang opposite to the kitchen window of the South Indian mess, had become the meeting place for my colleagues for a hot cuppa and long discussions about everything in general and nothing in particular. I still fondly remember shouting from the room to Rajan, the hardworking, pleasant-natured manager, for sending rent or man or un number of coffees, Sigram Khundwa. Wishing the alumni meet great and grand success for congratulations and congratulations to the team for organizing such a mega event. Regards from GB Advani, sir. The second one is from Dr. A.K. Agrawal, sir. Kindly accept my congratulations on the program. I hope it is a grand success. I wish I could participate, but my circumstances do not permit me to travel. However, I'm enclosing a brief note of my experiences at the department in AIIMS. I joined the Department of Psychiatry in July 1965 as a registrar. I was later promoted to lecturer in July 1968 and left the department in July 1969 to join as a lecturer in KG Medical College, where I served until 1999 when I retired. My stay in the department was very satisfying. At the time of my joining, Professor D. Satyanand was the head, Dr. A.S. Mahal was the assistant professor, and Dr. J.S. Teja was working as a tutor. Mr. G.G. Prabhu and Ms. Sakuntala Dubey ma'am worked as clinical psychologists. Mrs. K. Gupta worked as social worker. This was a very closely knit group. We ran a contributory coffee club. That was the place where we all met every day and exchanged views on things relevant and irrelevant. The first batch of postgraduates appeared in December 65 for MD examinations. During the first examinations, Professor Satyanand used to check with me if everything was properly organized. After the first examination, similar anxiety was never seen. I also enrolled as an MD student in Jan 1966 and completed it in December 68. The department was unique in many ways. At one time, all the staff members, excluding Professor Satyanand, were both postgraduate as well as in the staff. After the retirement of Professor Satyanand, things went into turmoil. Professor Teja moved to PJ Chandigarh and Dr. A.S. Mahal left for some assignment outside. I was the only staff member in the department. Dr. E.M. Hoch joined as a professor for some time. Later, Professor J.S. Niki joined the department as professor and head. Despite all these changes, the postgraduate training program continued smoothly. The beauty of our teaching program was that everyone was allowed to present his views experience. I enjoyed my stay and learned the fundamentals of psychiatry. These incidents are dated nearly 55 years earlier. There could be some errors due to imperfect recall, for which I request you all to forgive me. Kindly say hello to all friends who were there during my time. By Dr. A.K. Agrawal, sir. The third one is by Dr. Rishabh Gupta. Dear all, I would like to congratulate the department on its Golden Jubilee. It's a momentous occasion for all of us, those who are an active part of the department and alumni settled in various places across the globe. Special thanks to Professor Chadda and the team for deciding to celebrate the success of the department and inviting all of us to participate. It's a shame that I can't be there in person, but my spirit is very much there. It was my second home. I still remember the time I spent in the department with great joy and excitement. The department gave me the freedom to learn in my own way and the exposure to length and width of the subject. The journey never felt tiring, especially with some wonderful friends that I made there who stayed by my side during times happy and sad. I would not have become the professional that I am today without the vital contributions of my teachers, fellow residents, support staff, and all the patients who entrusted their care in my hands. I love to see you in person next time such a chance comes again. Please raise a toast on my behalf, cheering all of you and your efforts in making this department one of the best in the nation and an internationally recognized institution. Thanks a lot from Dr. Rishabh. And the last one is Dr. Sundar Jnanaveer. He has mentioned that he joined in 2010 and he left in 2015, and he's currently affiliated with as a consultant child psychiatrist with NHS UK and as a honorary senior lecturer in Newcastle University. He has mentioned that his most favorite memories at AIIMS included the Nescafe meetings after academics and the numerous departmental get-together about the gym and amazingly supportive faculty and peers. And message to alumni, we are privileged to be part of this amazing group. Pray that the flag of AIIMS Psychiatry Department fly high and long. Thank you.
Thank you, Preeti, for conveying those nice messages. We have two more video presentations. One is by Professor Shekhar Saxena. Dr. Saxena joined the department as a resident in 1979. He is currently a visiting professor at Harvard School of Public Health. He was formerly director of the Department of Mental Health and Substance Abuse at WHO. He was also a faculty member at AIIMS at one time. So I would request Dr. Kaushik to please run the message. Thank you, sir.
Hello. And I regret that I'm not able to join in person. I really very much like the opportunity to be able to interact with you. If not personally, then virtually. I spent 20 years of my life at the Department of Psychiatry. This was from 1979 to 1998. First as a student and then as a senior and then faculty. And whatever I've learned on psychiatry is the gift of the department. I learned some
voltage problem.
and skills were absolutely essential for me as a professional. I was fortunate enough to be taught by excellent faculty like Dr. Mohan, Dr. Prabhu, Dr. Chavla, Dr. Dubey, Dr. Ray, and Dr. Anandila, also by Dr. Suri Gupta and Dr. Manjumata. And I know that some of you are in the room, so my great respect and thanks to you for teaching me so well. My training was as good as could be anywhere. I also learned how to teach, and I'm actually using it here at the Harvard University now. I enjoy both. I enjoy patient care and I enjoy teaching. Teaching undergraduates even more than postgraduates, which was such a pleasure. The next turn in my career came because of one person, Dr. M.N. Vick, who joined the department just for 4 years, but it was at a very critical moment for my career. He also introduced me to WHO, where eventually I spent 20 years of my career. I learned that it is very important to treat individuals, but also it's important to serve communities and countries, which I did in the later part of the career. And I enjoyed that too. The department has given me a lot. It has made me who I am today. And I'm really very grateful for that. So with great respect and compliments to the department as well as to the faculty at that time and now, and I know the department is doing very well. I wish you all the success, even greater heights in the coming years. Thank you.
There's another presentation by Dr. Parminder Sachdev, who was both an undergraduate and a postgraduate at AIIMS, joining the department in 1981 as a resident. He is a science chair professor of neuropsychiatry in Australia. He's also a prolific writer, having authored several books. So we'll just have the presentation by Dr. Sachdev as well.
I'm delighted to be able to speak to you on the diamond jubilee of the Department of Psychiatry as its proud alumnus. My name is Parindra Sachdev. I currently work in Sydney, Australia. I am a senior professor of neuropsychiatry at the University of New South Wales and clinical director of the Leading Psychiatric Institute at the Prince of Wales Hospital. My journey in psychiatry in the mid-70s, and it was fascinated by the intriguing manifestations of mental illness. Professor J.S. Sneaky was head of psychiatry at that time, and there could not have been a more inspiring leader. Psychiatry was, however, not a popular choice for the specialty in those days, and many tried to dissuade me from this calling. When I started my MD in psychiatry in 1979, Professor Govinda Mohan was the interim head, and the department had a towering presence with figures like Professor G.G. Prabhu, Dr. Shakuntala Dubey, Dr. Premlata Chawla, and Dr. Harinder Mohan Chawla as teachers and mentors. Professor N. Ray joined as him midway through my MD. The department was part of the intellectual academy, and it was perfect ground for imbuing psychiatric practice with empirical rigor. Hence started my love affair with mental phenomena and the brain-mind relationship. I fondly remember the discussions and arguments I had in my senior residence, Drs. Rajat Ray, Anand Lal, and Harinder Sethi, and I go doing business, Drs. Pravesh Rustavi, Rahul Khandu, Shikha Saxena, Ian Shrestha, and many others. The walking clinic was a place with the most rigorous training in psychiatry. With the dozens of challenging patients passed through it each morning, offering perfect mental welcome in human university. Those memories have not faded with passing years. I left AIIMS in 1983, 40 years ago. But as they say, AIIMS is never. My early passion was cross-cultural psychiatry. PhD was on techno-psychological concepts in Maori culture in New Zealand. So it was inspired by Professor Ray's work on the heart syndrome and Professor Yaki's work on the Guru-Chela relationship as a therapeutic paradigm. My subsequent work has been in neuropsychiatry with a major focus on drug-induced movement disorders, Tourette syndrome, brain stimulation, neuroimaging, but more importantly on dementia and cognitive aging. I now lead the Center for Integrating Aging with Cognitive Development, as well as the Center for Research Excellence in Grasp Contributions to Dementia. The seed were also during my MD as growing lectures with the foundation for Psychiatry neuropsychology. I still remember the first patient I diagnosed with Tourette syndrome in the second year, who had been always behaved for schizophrenia. It was a time when the professor of neurology admitted to having never seen a case of Tourette. Dementia was rarely focused on attention except when it occurred in a young person. Psychosis is often referred to as the third psychosis, with no knowledge of the new in-depth lines. Psychiatry has come a long way, and our department, which continues to provide what I believe is the best treatment. I take this opportunity to thank you all for including the celebration. Our conference has a lot to be proud of. It could be some of the leaders in mental health in India and around. There's hardly any area of mental health and substance misuse that it has not passed. And it is keenly used training, not only in India, but internationally. I am so proud to be around this. Please join me in raising a toast to the department. It's faculty, department, and many young and aspiring psychiatrists will be good friends.
Thank you, sir. Now I would request Dr. Dubey, the photos which you had given, our amazing team has very rapidly digitized them. So if you could just tell us a little about the photographs.
I had given one photo of Dr. Neki,
Right.
and which has the very
Yes.
good memory of Prem Chawla. Yeah, this is Dr. Vick and Mrs. Vick.
Right.
Okay, and this one is Smita Deshpande. This is Smita Deshpande. Ha. Now she's a very prominent psychiatrist in Delhi. And who else? I think that person I am not able to recognize. If you can tell me, we are serving to Shrestha. Is it Shrestha? No. But anyway, tell Smita is not there. She is in Delhi. Remember that we were missing her. Yeah.
Right, ma'am.
Okay. This one is very nice photo.
You can take this.
This one? Okay. This is me, myself, and very happy days of ours.
Right.
Dr. Anand Vig. I knew him from Lucknow Medical College, Anand Vig. He has done MD in medicine.
Medicine from there.
And then he was fascinated when I had gone to Bangalore, NIMS nowadays called, and we were put with one psychiatrist, one clinical psychologist, and one psychiatric social worker to take care of the psychotic, and WHO team was there. Dr. Vick came to see that time. Then he went for DPM to England, and from then he went academics to AIIMS and Chandigarh. He was very loved. I think he missed Chandigarh always. So the last year, wherever, I think Dr. Khandiwal should remember Dr. Vick very well. This is why this photo. And Smita is again, Mrs. Chawla and Mr. Chawla. Mr. Chawla is very important. He has done MBBS from AIIMS. That is a blue-eyed of
Dr. Chawla, not Mr. Chawla.
Mr. Chawla. हम लोग इसको इसीलिए persona non grata रहता था और आज तक भी इतना अच्छा अब बैठ के ये अगर पेशेंट से जितना सुन सकता था. I think Mrs. Chawla has no patience. This is memories.
Right. And this is one more, I think.
And this is probably is Dr. Jain with Dr. Neki sitting. He is with me. He joined the department in 71 as faculty. But cultural shock of India, if you have worked abroad, this is for younger generation, I will say, is very difficult to adjust. Once you have gone abroad and got recognition over there, to come back and work, we are very fools like me, who worked here only. But I think I have done good service to my family, to my country, and to my subject. By working in India, I would not have been remembered so much in USA as today I am feeling it. You know, this is Indian culture.
Very good.
Thank you.
That is
This is
very
my
true, ma'am.
memories
Thank you
of-
so much. I would now like to hand the mic over to Dr. Hassan.
Thank you very much, Rishi. I am sure this was a very enjoyable session for all of us. Rishi has done a good job of compiling all the photographs and displaying for all of us. Thank you very much, Rishi. And of course, he was not alone. He was helped by an entire team, all under the able guidance of Dr. Ramandeep, right, and others. So speaking of photographs, इतने सारे फोटो देख के हमारा मन हो रहा है कि हम भी फोटो खिंचाएं. So let us go gather together for a group photograph. The choreography is like this. We will go out from this room, take a left turn, and then on the stairs of convergence block, we will all gather for a group photograph. Come back, quickly have something to eat, a cup of tea, and then in next 15-20 minutes or so, we will again gather back in this room. Please remember, for socializing, we will have ample time in the evening as well. So let's have this tea break about 15-20 minutes and then gather back in this room.